So what we find, as I said, is a profound interpersonal ambivalence. On one hand, they don't need anyone. They don't need other people, but it's a big world. There are a lot of people in it. And so there's confusion about that. Growing up in the world, it's a social world. It's a world full of people. We're sort of given to believe, especially when we're adolescents, that we're supposed to interact, that we're supposed to be part of groups, part of teams, partake in social life. But there's phenomenal ambivalence about this. What we find is very often they prefer animals, and many neglect survivors are animal lovers, vegan people who are fiercely, protective of animals. They don't like people very much, but they relate to animals and esteem animals and have relationships with animals because they're safe. An animal most likely will not break their heart. They often become caretakers because they're able to connect with other people without needing them, without having to hope or expect or rely on the other for anything that they might need. In fact, they might have a terrible time receiving anything, period, or receiving any kind of care. They won't let you take care of them, but they're great caretakers, a lot of them, very other directed. And what you'll find is because of their dysregulated nervous systems, their isolation, their hyper or hypoaroused systems, they look for something to settle themselves down, to occupy them. Addictions are very common. Substance use or compulsive activities that absorb this emptiness or this energy or keep them going, that is a real difficulty. And the kinds of programs for addiction recovery that require needing other people, like 12-step, is very, very hard for them. You'll find often they're interested in endurance sports where they spend many hours alone in these long distance physical achievements that require a lot of the body, give them a lot of time alone, that regulate them. They have a lot of time to think. They're really good at it. I certainly was. I rode double centuries, 200-mile bicycle rides in a day, and it was a way of kind of calming down, of filling myself up, of achieving something, of getting away, of being with other people and being alone in a way that I didn't really need anybody. As long as I could see someone somewhere in the distance, I wouldn't get lost. That was just about right for me. Achievement is another way that the self-reliant character kind of fills themselves up. Often they're very, very successful professionally. They work hard, they do well, and they look so good on the outside. They look so successful that no one sees that they need help. Often they don't even recognize it themselves. And I know it took me years before I became able to recognize this problem of neglect. And the way I discovered neglect was very much by accident. It was through trying to help my clients who were survivors of childhood sexual abuse that I called in their husbands, their partners, their male partners, to see if I could teach them to be better support to my clients. And I discovered these people that needed help themselves, but nobody noticed because they were so busy taking care of everybody else. So they don't get help. They're not squeaky wheels, and they often don't even know themselves that they are suffering because they don't have any category for why they might feel bad. They can't point to anything bad that happened to them. They think nothing happened, nothing's wrong, so why do I feel bad? I have no reason to feel bad. I have nothing to complain about. Exactly. They often have confused sexualities. And this is a really complicated category. And I'll tell you a little bit about this. Because how do you resolve the problem of sex when you don't want to need another person? Well, you could do it all yourself, and many people do, but it's not really the same to do it all yourself sexually. So what do? Well, they might have cyber partners. They might be sort of really into porn. They might use bathhouses or anonymous sex with people they don't know, so you can have sex, not get attached, not need the other person, maybe never see them again. That's one solution. Or you can have serial infidelities. You have a partner, but you have a lot of other partners that you don't get connected to, so you get your kind of sexuality needs met, so to speak, but you don't have to risk the possibility of attachment and loss. Or, as I see often, they partner with people who can't or won't or unable to have sex, or who have sexual problems, or maybe are maybe sexually non-conforming, and so they're not particularly interested in their partner. Perhaps they utilize sex workers and pay them and therefore don't get connected. Perhaps they become sex workers, or they become abstinent. All kinds of confusion about sexuality, and often a lot of shame, a lot of secrecy, a lot of never talking to anyone about it. And as a sex therapist, I hear so many cases of couples who have been together for years and they don't have sex with each other or with anybody. And no one talks about it. And no one asks about it. So psychiatrists put people on antidepressants without warning them. This will destroy your libido. Or oncologists don't tell people this chemotherapy, this cancer surgery is going to make havoc on your sex life. All kinds of things. Nobody talks about it. I have many clients who have been in couples therapy numerous times. No one ever asked them about sex. So these confused sexualities stay underground, stay unattended to, stay neglected to. It's another way that they suffer. What does that mean about us? Well, of course, therapeutic relationship is ridiculous. What are you talking about? You call it a relationship? And many of them come in with a trail of trashed therapies, a dustbin filled with failed therapists, and they can't wait to toss you into it also. So it's a hard sell that we have anything to offer. It's a hard sell that we could help them. We have to do what we can, but we also have to be able to tolerate this rejection of us. Another thing I should tell you about is that the child of neglect has no one to ask, nowhere to turn to find out how the world works. Now, many of our clients grew up, there was no Wikipedia, there was no Google, there was no YouTube, there was no internet. So they had to scramble to find answers to things. And when they did, they held on to what they knew like a lifeline. And they're very kind of self-important about what they know, and they know everything. So not only do they not need you or me, but they know everything, and we don't know anything, and they will let us know that. Now, one thing to be warned about is that, and I learned this the hard way, that they're often hypoaroused nervous system. What that evokes in us is a certain kind of sleepiness. And one thing I found was a signature long ago when I first started learning about neglect, was that when I was finding myself watching the clock or thinking that the time just would not pass, or I was so bored, or I was so sleepy, I could hardly stay awake through a session, that is a sign, that is an indicator of one of these neglect histories. And that the hypoarousal that I'm feeling in my own body, and this is what I want to help you learn to be very, very sensitive to. It's what I call receiving the communication through the field. And we'll talk more about this, including the psychoanalytic term projective identification, which is very interesting. But another clue about the interpersonal world of the neglect survivor is this sleepiness, this numbness, which is a result of contactlessness. There's a way that they don't connect. And one thing I've learned about myself is that when I feel bored or when I feel sleepy, it means I'm really connecting with their contactlessness. They're not being connected. The only thing that's boring is being in the presence of someone who can't connect. That's my experience. So try not to be rough on yourself when you get bored or when you get sleepy. And actually, I'm horrified to admit, but I love to share this story because it's a good learning story. And one time, and I really hate remembering it, but one time I fell asleep. And it was this lovely man. He was this very sweet neglect survivor, musician, very lovely person. And I fell asleep, and he laughed and said, "You fell asleep." And I was horrified. And he said, "It was just for a minute." And he laughed. And I was so just shocked and embarrassed and ashamed. And it didn't faze him because he was so accustomed to being neglected, to being discounted, to not having the attention of the other, that it was like another day in the life. The therapist falls asleep. It was kind of a joke. And I was horrified. And then, and he stayed, another couple of years in therapy. Then he left. And I wrote my neglect book, and I wrote about this in my book. And when he, interestingly, perchance, shortly after my book came out, and he hadn't read it, he came back to therapy because he wanted a little sort of tune-up. And so I saw him again, and I was telling him, I was remembering you because I wrote about that time that I fell asleep in our session. He didn't remember. He forgot that it had happened. It was such a non-event to him. To me, it was traumatic. To him, it was no big deal. He forgot that it had happened. Anyway, so that is the other side of the rejection, that sometimes they're so used to it that it doesn't even register when they are somehow eliminated from awareness, even for a moment. So often they are exquisitely sensitive to rejection and criticism. Other times they're completely immune to it because it's so normal to them. Another thing I wanted to just sort of alert you to, and I'll say more about this later, is they are very sensitive about therapist self-interest. So they'll be watching for that. And one brand of neglect is having a narcissistic parent. I certainly had one, where my father was so full of himself that he was the cantor of our congregation when we were growing up. So he sort of thought of himself as a big shot. And so when I would meet somebody new, he would say, "So do they know who you are?" Meaning, do they know that you're my daughter? As if that was my only identity, was this sort of extension of him. It was like there was no me, there was only him. The narcissistic parent is another way of obliterating the child's existence, the child's self, the child's value, the child's having any identity at all. So they'll be watching you very carefully, like a hawk, to make sure that you don't eclipse their interests with your own. So it's a very interesting spin on the self-reliance. They're very skittish about, well, trust, which is sort of an impossible achievement, at least for a long time. So they'll be watching you to see what your priorities are and how you relate to them or not. So the last thing I'll say is that we must have a lot of humility, a lot of patience, and a lot of support. And I think of it often as a relay race, that we do what we can for as long as they stay. And then we pass the baton, hopefully, to the next therapist who will pick up where we left off and hopefully continue the job, so that if this person has the stamina and the courage and the heart and the patience themselves and the humility and sufficient hope, they will continue, and maybe somebody else can do better or can do more or can last longer or stay out of the dumpster.